FTM Top Surgery is a fantastic procedure to achieve a more masculine chest wall contour. In addition, it's one of my personal favorite procedures because it's life-changing for the patient and there's immediate gratification for the surgeon. It's incredible. Surgical candidates for FTM Top Surgery are patients that have a stable weight, are not smokers, have no other major medical issues, and have a personal desire for a more masculine chest wall contour. And that's really important. This comes down to the patient and their desires and how they view themselves and their own personal aesthetics. And you gotta make sure when you have surgery, it's for you and not for anyone else. In that initial surgical consultation, I have a very open discussion with the patient about what their aesthetic goals are with top surgery. And this is an extremely important point because no two patients are the same, and every patient has their own ideal aesthetics and their own vision of beauty. And so as a surgeon, you need to take the time to get to know your patient. Really have an open discussion with them. What is their vision? What are we trying to achieve with surgery? During our initial consultation, we will also do a physical examination. This is to evaluate how much native soft tissue we have, as well as determine the location of the nipple areolar complex. This physical exam and measurements will help guide us to the safest surgical approach to help you achieve your cosmetic goal. The two most common approaches for FTM top surgery include a circumareolar approach or a double incision approach with or without a free nipple graft. Ideal candidates for the circumareolar approach have minimal glandular tissue and minimal soft tissue, as well as their native nipple areolar complex is in the ideal position, which is roughly at the inferior border of the pectoralis major muscle. Ideal candidates for the double incision approach have moderate to large amounts of glandular tissue, and typically their native nipple areolar complex has descended below the inferior border of the pectoralis major muscle. With a double incision approach, patients have the option of keeping their native nipple areolar complex as a free nipple graft. So this is a super important point. When doing a double incision, it is 100% up to the patient whether they want to keep their nipple as a free nipple graft. Honestly, about half of my patients keep the nipple as a free nipple graft and the other half don't. It just depends on the patient's personal aesthetic goals. So all surgical procedures have risks and complications, and top surgery is no different. So I always mention to my patients the big three complications. 1, bleeding. 2, poor scarring, and then 3, infection. So those are my big three that I get concerned over. The risk for these complications is low, but it's not zero. And so I have an open discussion with all my patients that all surgery has risk and top surgery is no different. Most of my top surgery patients have a fairly rapid recovery, and by day 3 to day 4 post-op are back to their baseline. However, I tell all my patients no heavy lifting for 6 weeks. The reason for this is that when I close your surgical site, there's 3 layers of dissolvable, absorbable suture, and I don't want you to develop a wound in the healing period. So take it easy. Think about a gallon of milk or 5 pounds per hand, nothing heavier than that, to help us ensure a fantastic surgical outcome.